Hello, welcome to ANA community. Continuing with the Bahya Srotas, initially with Sya or mouth, followed by the discussion on Netra, then Nasa, afterwards Karana. These are the Urdhvas Bahya Srotas, that means the natural orifices present in the head and neck region. After that, we have discussed Guda or anus. After that, the uh, medra or the urethral meatus. After that, yoni or vaginal orifice. Today, we are going to discuss the breast as such or stana, which is considered to be the two srotas, bahya srotas or natural orifices present in the females, along with vaginal orifice. Totally 12 in females as such. Among them, 9 are present in the both the male, even in the male genders, males also. Apatya pata or vagina and 2 breast tissues are present in the females. When you think about the breasts, they are considered to be the two bahya srotas present in the human body. Specifically, the functional breasts, they are present in the females, present in the antaradhi, what we can say the part present between the head and neck and the lower limb, specifically in the urus region. This is actually responsible for the expulsion of kshira in the during the lactation period. As far as functional anatomy of the breast are concerned, that is having the nipple at the center. On the either surrounding the nipple, it will be areola, which will be a darkened tissue. Later, that will be associated with the skin, which is having the what do you say that the lobes of the mammary glands, wherein the milk will be produced. This will be this will be coming into the nipple during the lactation as such, in cases of the uh, after the parturition. This is what we can say about the functional anatomy of the breast as such. So that will be responsible for the milk production after the delivery. As far as the nidana of stana vikara are concerned, so in case of the presence of milk, when the women are not giving the milk or reluctant to give the milk to the babies, there may be a possibility of what do you say that the pain in the breast may occur. Obesity is considered to be one of the risk factor for the development of breast cancer. Radiation exposure, so that means frequent X-ray chest as such may have an impact on the what do you say stana as the breast as such. In case of elderly individuals, the women who are getting pregnant after the older age group, so that means if the age is more than 30 years, the risk of the malignancy of the breast will be high. Alcohol consumption may be another risk factor. Family history of breast cancer or personal history of the previous breast cancer may be leading to the what do you say breast disorders as such, and early menarche. So if the girl is getting the menarche at the age of less than 12 years of age, then that may lead to the stana vikara. As far as significance of the breast are concerned, exposure to microorganisms may be possible in case of poor personal hygiene during the lactation, and there may be a possibility of the excessive stimulation of the breast during the sexual intercourse. which may lead to trauma to the breast tissue. Then Kshara, Agni Karma or Shastra Karma to the breast tissue, wherein there may be a possibility of Sadhyavrana, and if the Sadhyavrana Chikitsa is not being done properly, so then there may be a possibility of the Stana Vikara. So because of the poor personal hygiene, local hygiene, there may be a possibility of entry of the pathogens that may enter through nipple, which may lead to the damage of the breast tissue. Thereby, there may be a possibility of inflammation to occur in the breast tissue. So, this will be leading to the presence of what you say that the pain in the breast, or otherwise the abnormal discharge, first discharge may occur, or there may be a possibility of the lump in the breast, etc. may be observed, which will be leading to inflammatory changes in the breast tissue, which is again indicative of a intracellular compartment affliction. The take-home messages from today's discussion are: Stana or breast are again one of the important Bahya Srotas which gets afflicted because of abnormal vihara, such as improper personal hygiene or local hygiene, or improper administration of Kshara, Agni or Shastra Karma. This may lead to affliction of the Srotas as such, wherein the clinical presentation may vary from simple pain in the breast tissue to life-threatening bleeding from the breast tissue, or a breast lump in case of carcinoma of the breast, etc. Depending upon the number of pathogens entering into the breast tissue and virulence of the pathogen entering into the breast tissue may determine the clinical presentation or severity of the disorders related to breast tissue. So, the best way of treating the diseases in this particular occasion will be avoiding the entry of pathogens into the breast tissue, either via proper local hygiene, etc. So we can able to, or otherwise if there is the disease manifestation, by giving the proper treatment to the breast tissue may lead to the recovery of the diseases as such. So that's why it is being mentioned that identify the cause and eliminate the cause to have the fastest recovery in the short possible time. Ayurveda says, Sanshepatah Kriya Yogo Nidana Parivarjana. Identify the Nidana first, which itself is responsible for the treatment of the disease up to 50% itself. That means we can able to manage the condition very fast. So that's all for today. What are the major key takeaways? Dear ANA community, mention in the comment box below. And what is the one video that you would like to hear in the coming days? Mention in the comment box below, and spread this particular video to maximum number of true Ayurveda learners, so that we can make a huge movement out of this particular small message. That's all for today. Something more in the next video. Thank you.